Hello, my name is Steve LaCroix. I'm the clinical manager at Mercury Medical. I'm a paramedic and respiratory therapist, and I'm here today to talk a little bit about lung volume recruitment, as well as introducing Mercury Medical's lung volume recruitment kit. Some people may hear the term LVR, that's just a short version, but really what we're talking about is breath stacking. And so what are we trying to do? What's the reason for this type of therapy? Is that we really want to improve the peak cough flow. A lot of these patients can't create enough of a gas flow to help with cough, and it's important that we're able to cough and remove secretion so we don't develop things such like pneumonia. We also want to improve the maximum insufflation capacity of the lungs themselves. A lot of times the lungs become stiff, they don't have the capacity they need, and that creates some real issues for folks when they're able to do that. So what kind of patients would need this? Generally, you're looking at people with neuromuscular diseases where they just don't have the muscular strength to take the deep breaths. It could be folks such as who had neurological trauma, spinal cord injuries, where they're not taking the breaths that they need. So this is going to be something that's kind of an exercise, even though the lungs are not muscles themselves, but we're exercising the chest muscles and the diaphragm and things like that. So the purpose basically is increase the volume. We're going to increase their ability to cough because they can take deeper breaths. We're going to open up areas that may be collapsed down called atelectasis, and atelectasis leads to other complications such as pneumonias and difficulties such as that. And if we can improve the airflow, it also makes their ability to speak much better. So obviously this is a much better for the life of the individual that's being treated. So when would we do this? Most often, doctors or therapists will prescribe to do this 2 or 3 times a day, maybe a little more, really up to them. And then each session could be anywhere from 3 to 5 breaths. Now, this will take some practice and working with a therapist or maybe a healthcare giver to be able to do the assistance. Some patients can do this themselves. A lot of them cannot. Now, there does come with some cautions. You can potentially have issues with breath stacking because we're actually increasing the capacity or stretching the lungs. If somebody's coughing up blood, what they call hemoptysis, this would be a time to not do breath stacking. If you've got somebody with a low blood pressure, anytime you put high pressure into somebody's lungs, it has a tendency to lower their blood pressure. So if you hear the term hypotensive or low blood pressure, that's not the time to do LVR. And if you have a certain types of lung diseases, COPD, that may have developed what they call boluses in the lungs, which are basically weak areas, this breath stacking could actually cause a lungs to collapse. So obviously that's something that we would want to avoid. To introduce the kit, this is Mercury Medical kits here. What becomes obvious from the beginning, it looks like you've got the large football-shaped bag that looks like a resuscitation bag, but very big caution here is this is not to be used for resuscitation. As you're going to see, there's some limitations. If you try to use this for resuscitation, it could cause harm. Even though it very much resembles a resuscitation bag or CPR bag, this is not what this one is used for. So it comes obviously with the ventilation bag. It also has 50 cc's of corrugated tubing to give you some flexibility and ease of use. There is a connector here which houses a one-way valve that the air only goes towards the patient, so the patient would not be able to exhale through this. It just goes one way. And this connector also has the ability to put a mouthpiece on. Most patients will be able to use a mouthpiece, but there are times that some patients can't use a mouthpiece, so a mask can be purchased separately that would go in place of the mouthpiece, so you could do it that way. And there are occasions where patients who may have trach tubes at home, that type of thing, where they could use lung volume recruitment, and you just would use a trach adapter in place of the mouthpiece. All these will adapt on the same connector. The kit also comes with a pair of nose clips. It's not mandatory to use nose clips, but there are some patients, especially when they first start doing this, that some of the air is going to leak out of their nose if they're using a mouthpiece. So that's why we would block off the nose. This would be something that would be when the therapy started to figure out, is this something that they should do or should not do? When you get to the point that they're going to actually do the therapy, it's not the thing that we want to squeeze the bag totally flat. We don't really want to cause harm. And it takes some practice on the beginning to figure out what number of breaths or how many breaths and the size of the breaths is going to work for the individual patient. So you'd have a patient exhale and then take in a maximum breath that they can do. And then they put the mouthpiece in, or you put the mask over their face, and you're basically going to add some air. And then you're going to you may do this anywhere from 3 to 5 times. Okay, they're going to tell you they can feel the stretch, hopefully. They can feel, we don't want them to be in pain or any kind of discomfort from doing this. So we'll start out with like 3 breaths doing that. And once we finish the breaths, then we would have to take the mouthpiece out or the mask off, allowing the patient to exhale. And this would be done 2 or 3 times, maybe as many as 5. And this could be anywhere, like I said earlier, anywhere from 2, 4, maybe 5 times a day that this therapy is repeated. So pretty simple process, pretty simple to use. If you have any further questions, you can contact me at slacroix@mercurymed.com. If you have any questions, if not, then have a good day.